Are fillers over? My name's Tristan, I'm a cosmetic doctor. Let me explain. We hear a lot about how fillers are down in the aesthetics market, something called filler fatigue, and I want to explain a bit about why I think that's happening and why actually it's a good thing. About 5 years ago, I think we were overutilizing fillers for everything, whether our patients came with volume loss or looking for new structural features or looking to improve their skin quality. Whereas, in fact, cross-linked fillers are really good for creating deep structural volume and superficial surface contour. They can't treat everything. They can't create significant collagenesis on their own. They can't improve skin condition on their own. And quite often we are overfilling patients by thinking that a larger volume is always better. So I think we have learned a lot over the last few years, and I think patients have become more aware of thinking about improving the skin condition and the architecture of the face first, before then thinking about the deep structural volume. And so then we've got a broader mix of treatments now, including more regenerative treatments, things like skin treatments and polynucleotides, for example, and also a resurgence in biostimulated treatments, which are really important to lay the foundations before we think about volumizing the face. The aesthetics market is still growing. Injectable treatments on the whole are still up, but the proportion of those that we were fillers is less, and that's just because I think the industry is a bit more wise now. What do I think will happen in the future? Fillers will still very much have their place, but when we come back to fillers and when fillers really start to take off again, we'll be doing it in much more intelligent and appropriate ways, and that really comes down to understanding the right products, the right patient selection, and having a deep understanding of anatomy and the aging process. So all of this comes back to having a good understanding of what we're doing in aesthetic medicine and why we're choosing the products that we choose.